Hello and welcome to our presentation on the Maryland Physical Therapy Dry Needling Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Dry needling means a physical therapy intervention, also known as intermuscular manual therapy, that involves the insertion of one or more solid needles, a mechanical device, into the muscle and related tissues to effect change in the muscle and related tissues. It requires ongoing evaluation, assessment, and reevaluation of the impairments, and is only utilized in parts of the body with neuromuscular and musculoskeletal links to these impairments. Dry needling is not performed for the purpose of acupuncture or for any purpose outside the scope of physical therapy. In order to perform dry needling, a PT shall have at least 80 total hours of instruction, which includes a total of at least 40 hours of instruction in the following dry needling specific course content areas: theory and application of dry needling technique including spine and extremities, dry needling indications and contraindications, infection control, OSHA's bloodborne pathogen protocol, and safe handling of needles, emergency preparedness and response procedures related to complications associated with dry needling, and appropriate documentation of dry needling. You will also need at least 40 hours of practical, hands-on instruction in the application and technique of dry needling under the supervision of a licensed healthcare practitioner competent in dry needling procedures who has completed the requisite coursework and practiced dry needling for at least 5 years. A physical therapist may not fulfill any portion of the practical, hands-on instruction required with online or distant learning. The instruction shall be provided by a continuing education course sponsored by the APTA of Maryland, the Federation of State Boards of Physical Therapy, or the United States Armed Forces. A PT shall have practiced physical therapy for at least 2 years before performing dry needling in Maryland. A PT shall be registered with the board as having the appropriate education and training required by the regulation before the physical therapist may practice dry needling. In order to be registered to practice dry needling, a PT shall submit a completed application on a form supplied by the board and pay a registration fee. A PT shall fully explain dry needling to the patient in advance of treatment and obtain written informed consent specific to dry needling that shall be included in the patient's medical record. A PT shall perform dry needling in a manner consistent with the standards set forth in the Maryland Occupational Safety and Health Act, Labor and Employment Article, Title V, and a PT shall document the provision of dry needling services in accordance with the documentation requirements. A PT who practices dry needling in a manner inconsistent with the standards of practice enumerated in the regulation shall be subject to discipline, and dry needling is not within the scope of practice of limited physical therapy and shall only be performed by a licensed physical therapist. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.